My name is Lucy Murray. I'm the Spin for Crohn's and Colitis Cures Manager for the Greater Los Angeles chapter. I just want to, before I introduce our speaker, I just want to take a quick moment to talk about the program that I'm very involved in and managing, which is called Spin for Crohn's and Colitis Cures. It's an indoor cycling event that raises money for the foundation. We're having our event on November 4th at a studio called Flywheel in Santa Monica. So if you like riding an indoor cycling bike in those classes, it's great. If you don't, you can stay in the back and pretend. We ask people to recruit teams of 4. You raise $1,000 between you, and then you ride together in a 45-minute high-impact, totally great energy class. Afterwards, there's a little outdoor party on the patio with music and food and activities. So we do also have opportunities for VIP teams to raise $2,500 or more. And it's a great way to get involved with the foundation. So anyway, hope if you are interested at all in any more information about that, please see me. I would now like to introduce our speaker, Kelly Issokson. Kelly is a registered dietitian specializing in IBD. She obtained her master's degree in nutrition from California State University, Northridge, and completed her clinical training at Cedars-Sinai. At Cedars-Sinai, she provides medical nutritional therapy to clients in the IBD Center, the Outpatient Nutrition Counseling Center, and at the Nutrition and Integrative IBD Program. Ms. Issokson understands the importance of eating food that is not only healthful and healing, but also enjoyable and delicious. She provides customized nutrition advice along with the resources necessary to implement and sustain a balanced diet. Welcome, Kelly, and thank you.
Thank you, Lucy. Okay, so thank you all for being here this afternoon. As Lucy said, I specialize in IBD, and one of the most common questions I get from my patients is, what can I eat? Like, what can I eat to help my IBD? So we're going to talk about that today, and hopefully you'll have some answers at the end of the session. So these are some of the objectives I want to touch on, and I want you to walk away with, is just to understand the role of a healthy diet in inflammatory bowel disease, be able to describe one diet approach for reducing inflammation, and then describe one dietary approach for managing GI symptoms. So I work with Dr. V. I don't know if you just heard his talk, but I work with him in our nutrition and integrative program here at Cedars, and it's a multidisciplinary program. And what we did was we looked at our patients that we were seeing in clinic, and we found that a lot of them, a huge percent, 77, had not previously met with a dietitian. And our patients' primary goals were to use nutrition to help manage their symptoms, followed by manage their disease. Our patients had a lot of food avoidances, primarily dairy, fiber, gluten, and red meat. And when you start to cut foods or food groups out of your diet, that can set you up for malnutrition or nutrient inadequacy if you're not working with a dietitian or your doctor to help you incorporate some of those other alternative nutrient-rich sources in your diet. So it's really important to always, work with your team of doctors or dietitians if you're thinking of adjusting your diet. So we know that, there is evidence that food additives can alter the microbiota as well as disrupt the intestinal barrier. Dr. Mayer talked about that earlier this morning. Food additives such as xanthan gum, carrageenan, carboxymethylcellulose, and maltodextrin, and we mainly see these in processed foods. They're not, natural. They're not naturally occurring in the environment except for the carrageenan. And this is just a nice graph from a study that was recently published showing all of the different factors that are involved in the pathogenesis or the development of IBD. And you'll see that, food does play a role along with other factors. But up here, a diet high in fat and sugar and processed foods, or like a standard American diet, commonly abbreviated as SAD, would fit right there in the IBD pathogenesis. So what do you eat? Yes, there are, like, maybe there are some foods in the diet that can contribute to the development of IBD. If you have IBD, does that change? So if you do like a Google search of diet for IBD, you're going to get a lot of, conflicting information. This was a study done by some researchers in 2014 who did exactly that, Googled diet for IBD, and they broke it down by food group: fruits and veggies, protein, fiber, beverages, and other. And there were sites that recommended to include these food groups, sites that recommended to avoid these food groups, and then there were conflicting information within the same site. So it can be really confusing. So what are the nutrition therapy goals? Well, as a dietitian, I want to use nutrition as supportive or primary therapy to help correct or improve or prevent malnutrition, to help you feel better, and to improve your QOL, or your quality of life. And we do this through modifying the diet, or trying therapy called exclusive enteral nutrition, which we'll get into later. Or if maybe you're really sick and your gut just isn't working, we use IV therapy, or TPN, total parenteral nutrition. But I have my own goals as a dietitian, but my patients' goals are, they are the most important. So we try to provide patient-centered care and incorporate patient goals into the nutritional therapy regimen that we eventually prescribe. So what is your goal for nutrition therapy? Do you want to use nutrition to help manage your symptoms? Because there are certain diets that can do that, such as a low-fiber diet, low-fat, low-lactose, gluten-free, low FODMAP. Those can all help you to feel better, but as Dr. V mentioned, there can be a disconnect between how you're feeling and disease activity. Do you actually still have active inflammation? And then we can use diet to help reduce inflammation, which we'll get into in further detail in the coming slides. There are specific diets that we recommend if you're actively inflamed, and there are other diets that we recommend if you no longer have active inflammation and you want to use diet to help keep you in remission. So if you only take away one thing from this talk, let's keep it simple. It's basically about eating food, right? Not processed food, but eating real whole foods, not too much, and eating mostly plants. A plant-based diet will help your health in general. So eat food, not too much, mostly plants. Basic nutritional needs for individuals depends on a lot of factors. Your age, your gender, your level of activity. If you go to choosemyplate.gov, you can type in, how old you are and how much you exercise, and it'll kind of generate individual recommendations for fruits and veggies and proteins and all of that you should try to aim for every day. But here is a summary of the dietary guidelines for Americans. Half of your plate should be fruits and vegetables, so primarily plant-based. Half your grains should be whole. So instead of having white rice all the time, try to throw in some brown rice or quinoa, some whole wheat pasta. Low-fat dairy products. Try to vary your proteins, so not just animal proteins, but also plant-based proteins like soy or legumes. And then drink or eat less fat and sugar for overall health. One of the best things you can do is just reading the nutrition facts and ingredients list. That'll tell you a lot about the food product that you're purchasing and that you're putting into your body and how it's going to affect you. In most cases, the fewer the ingredients, the more whole the product is, and the better it's going to be for your overall health. This is a nice infographic from the Harvard Medical School, and it's really trying to emphasize the or how to make your plate fit the Mediterranean diet, which I feel is one of the best diets for general health. And it incorporates healthy oils, so anything that's liquid like olive oil, avocado oil, grapeseed oil, canola oil, those are all good and should be your primary cooking oils. Over animal fats, you want to kind of try to avoid anything that's solid like butter and lard. Make half of your plate fruits and vegetables. Again, big emphasis on plant-based diet. Try to incorporate whole grains and then some sort of healthy protein like fish, poultry, beans, and nuts. Limit red meat and cheese. Avoid bacon, cold cuts, and processed meats. I don't know if you know this, but the World Health Organization classified processed meats as a grade 1 carcinogen, along with tobacco and asbestos. So it's really not good for us. It's not good for our health. It can increase our risk for colon cancer and breast cancer. So we really want to try to avoid those foods if possible. Okay, so why is nutrition important in IBD? We do know that a large percent of our patients, up to 85%, are malnourished, and the risk of malnutrition goes up in Crohn's disease. And some of the causes for malnutrition include, just not eating enough because you're not feeling well. Maybe you have increased needs because you have active inflammation, which means you're going to be burning more calories, and you need to probably be eating more in order to prevent weight loss. Maybe you're not, maybe you have active diarrhea and you're not just absorbing your food and nutrition as well as you should be. Or maybe you've had an intestinal resection and that increases your risk for malabsorption. And certain medications can also affect nutrients in the diet in terms of increasing your needs for protein or calcium or vitamin D, as well as surgery. So malnutrition can affect your rate, if you're going to have surgery, it can affect your rate of post-op complications. It can increase your rate of infection, and it can impair your immune function, your mucosal barrier, and it can increase your risk for bacterial translocation, which just increases your risk for infection. And these are some of the common nutrient deficiencies that I see in my patients: vitamin D, calcium, B12, B6, iron, and zinc. And if you think back to the beginning of my talk when I was saying most of our patients avoid gluten, red meat, and dairy, as well as fiber, this is where those nutrients are going to be found in those foods. So if you're not having dairy products, for example, you might not be getting enough calcium or vitamin D in your diet. If you're not having red meat or animal products, you might not be getting enough B12 or zinc. So those can all impact your bone health, your level of inflammation, your response to medications, development of blood clots, your taste acuity or your appetite, and overall your quality of life. And vitamin D has been getting a lot of attention in IBD, especially recently. And there was a paper that was published that showed that lower levels of vitamin D were associated with more disease in IBD. So we want to aim for a level of greater than 35, because less than 35 was associated with increased risk for IBD relapse. So if you haven't had your vitamin D levels checked recently, ask your doctor to check them. And this is just a paper that, is a longitudinal study, so over 5 years, that looked at people with IBD, and almost 30% had low vitamin D levels, so it's pretty common in our population. And these people they needed more steroids, more biologics, more narcotics, more scans, more emergency department visits, hospital admissions, surgery. They had worse pain and worse disease activity scores. But those who got supplementation had reduced levels of those, these issues. So it's important to check your vitamin D and take supplements if you are low to help, your overall outcomes. This is just a table of some of the nutrients that I mentioned earlier that I commonly find in my patients to be low. So calcium, especially if you're avoiding dairy or if you're on high-dose steroids. And this is going to be dependent on most people need around 1,000 milligrams a day, but you are going to need a little more if you're on steroids. Vitamin D, this is the recommended dietary allowance, 600 IUs, which is pretty low. Most of my patients have to be on some sort of 1,000 units a day, up to 5,000 units a day, to help maintain those normal vitamin D levels. And you will need more than that if you are deficient. Zinc levels can be low, especially in those on vegetarian diets or with high ostomy outputs, or even with fistulizing disease. So it's important to, if you have any signs or symptoms of zinc deficiency, such as a red rash on the palm of your hands, hair loss, or decreased taste, maybe ask your doctor about, possibly checking your zinc levels, and then we can supplement you if needed. Folic acid is important, especially if you're on drugs like methotrexate or sulfasalazine, or if you're on a restrictive diet. B12 is important, especially with those who have inflammation in the last part of their small intestine, the terminal ileum, because that's where we absorb our B12. So you might be low. Some signs of deficiency would be anemia or maybe some tingling in your fingers or toes. Fat-soluble vitamins, vitamin A, vitamin D, vitamin E, vitamin K, those can be low if you are not absorbing your fats, or if you've had a large resection of your small intestine. So it's important to monitor for those as well. And then iron deficiency is very common, especially in our patients with ulcerative colitis. And some signs and symptoms of iron deficiency will be like fatigue, cognitive impairment, or hair loss. So nutrition for managing your symptoms. These are some of the ones I mentioned earlier, and I'll go into more detail about those. So if you have a lot of diarrhea, or if you've had a recent surgery, you might want to limit fiber, or you might have been told by your surgeon to limit fiber. So what is fiber? Fiber is a non-digestible carbohydrate, and there's two main types. It can be fermented or not fermented. So that just means fermented by bacteria. So some fibers can make you more gassy. Some fibers can make you not affect your gas levels at all. So we have soluble fiber, which has a high water holding capacity, such as psyllium, guar gum, and oat bran. And soluble fiber is really important, especially if you have a lot of diarrhea or if you have high ostomy output. It can help to really slow things down. It can help to make your stools a little more formed. And insoluble fiber basically has a mechanically irritating effect on the colon, and it stimulates water and mucosal secretion. So it helps to make stools easier to pass, especially if you're constipated. So what your surgeon wants you to avoid, or what you should probably maybe try to limit when you have a lot of diarrhea, is insoluble fiber, and that's mainly going to be like the outside of fruits and vegetables, whole nuts, whole seeds. Those are going to be the rich sources of insoluble fiber. Rich sources of soluble fiber will be like applesauce or bananas or vegetables that have been peeled, and you're just eating the inside. So again, consider if you have diarrhea, if you have intestinal narrowing or recent surgery. These are some of the higher fiber foods that we just mentioned. So have these instead: peeled, cooked fruits and vegetables, ripened fruits, creamy nut butters or seed butters. If your surgeon told you can't have nuts or seeds, you can have creamy peanut butter, creamy cashew butter. Those would be okay because there's no risk for obstruction there. And the soluble fiber in the nut butters will help to slow things down. And it's not just fruits and vegetables, but tough meats can also be problematic because they're just harder to digest and break down. So instead of having grilled steak or big chunks of tough proteins, have things like eggs, yogurt, tofu, fish, ground meats, and tender meats. But most importantly, chew foods well and eat slowly, because you want to kind of put your body in a rest and digest mode. Things become harder if you're stressed out. If you're eating quickly, you're probably not going to feel as great after you have that meal. Low fat or a low lactose diet can help you to feel better in terms of reducing nausea, diarrhea, bloating, or reflux. So some common high fat foods would be fried, oily, and greasy foods, large portions of nuts. Even though those are good fats, they're still fats, avocado and olive oil. And instead you can try baked, roasted, boiled, or sauteed foods. Those are going to be all lower in fat and help you to have less of that nausea or diarrhea or bloating feeling. When you're nauseous, you want foods that aren't going to sit in your stomach for a long time, and the more fat that you have in your diet is going to just really slow things down. So that's why eating low fat can be important and helpful. It's common to develop lactose intolerance, especially as we age. We're just not like meant to digest lactose so late in life. So it's not specific to IBD. It's really, it's across the board. Most people can't digest lactose. So it can be helpful if you have something like reflux, bloating, diarrhea, or abdominal pain to cut back on lactose, or try lactose-free products. So high lactose foods are basically like the soft cheeses or like milk or cream. Those can be really high in lactose, the sugar. And things that are lower in lactose are going to be like plain yogurt, aged cheeses, anything that's hard or aged for more than 30 days, lactose-free milk, nut or rice milk like almond milk or rice milk would be a great alternative. Soy milk tends to cause bloating in my patients, so just kind of try to see what you tolerate. And make sure that those nut or rice milks are fortified with calcium and vitamin D, because on their own, they're very low in calcium. And then some people might use a gluten-free diet to help them feel better. So what is gluten? Gluten is a protein found in wheat, barley, and rye. And some people might experience an increase in bloating or gas or discomfort when they have gluten-containing products. So trying a gluten-free diet can be helpful for some of my patients. I just want to emphasize, though, that if you are going to try a gluten-free diet, to be sure and discuss that with your doctor or dietitian first. And sometimes it can be helpful to just make sure that you don't have celiac disease before we put you on a gluten-free diet, because if you're already on a gluten-free diet, we can't determine if you have celiac. And we don't know, like, how strict you need to be with the gluten-free diet. Like, is it actually causing destruction to your small intestine and preventing absorption of nutrition when you cut out, when you eat these gluten-containing products? Or is it just more like making you feel not so great? So it's really important to distinguish. A gluten-free diet also does not appear to affect IBD disease course. But like I said, it can help some people to feel better. So this is a really popular diet in recent literature. So low FODMAP is it's an acronym that stands for certain sugars in the diet. And when we reduce these sugars, people tend to feel better. This diet was developed by researchers at Monash University. It's primarily used in the treatment of IBS, irritable bowel syndrome, which is very different from IBD. But if you have IBD and you don't have any active inflammation, you can have some symptoms not associated to your IBD. So that's where this diet really comes in handy. So again, FODMAP is an acronym, and it stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. You don't need to remember that, but these foods are very common in our diet, and they include like wheat and onion and garlic and beans and watermelon. So cutting these foods out of your diet temporarily can help you to feel better. But I want to emphasize that this is not a lifelong diet. It's a short-term diet that you follow with the help of a dietitian. And then after like 4 to 6 weeks, you start to add these foods back in. And it helps you to really understand which foods could be making your symptoms worse and at which dose. So this was just a study of people with IBD who went on a low FODMAP diet, and here is baseline GI symptoms. So they had, a lot of abdominal pain, diarrhea, bloating, constipation, nausea, fatigue, reflux, and gas. And then this is after the diet, so their symptoms did go down. Most of the symptoms went down except for constipation. So it tends to be more helpful for people with diarrhea, gas, bloating, and abdominal pain. And another reason you should not be on this diet for long term is because it's low in fiber. It can be low in vitamin D as well as low in calcium. And we do know that, following a long-term low FODMAP diet can alter our intestinal microbiota. So, in a non-beneficial way. So that's why we don't want you on it long term. So before I get into the diets for helping reduce inflammation. I just want to talk about what remission is so that we're all on the same page. So say this guy represents clinical remission. Basically means you're feeling good, right? You don't have any active symptoms, you feel great. But, as Dr. V mentioned, there can oftentimes be a disconnect between how you feel and what's going on inside. So that's why it's really important to, follow up with your doctor and get those scopes just to make sure that you actually don't have any inflammation inside. So we have clinical remission, we have biochemical remission, which is basically where the doctor checks your lab levels, like your SED rate and your CRP, or your fecal calprotectin, like your stool inflammatory markers, and we can see if you have inflammation. And then there's endoscopic remission. So that's where, you go in and you have your scope and the doctor doesn't see any active inflammation. And then there's histologic remission, which is considered deep remission. And this is like one of the primary goals of therapy. This is where we want you to be. We want you to feel good. We want you to have no active inflammation when the doctor does your scope, and then no inflammation when they look at your tissues, under a microscope. So nutrition for inducing remission. How many of you have heard about this specific carbohydrate diet? Okay, so it's very popular in the IBD community. It was invented in the early 1900s by Dr. Sidney Haas for people with celiac disease. When these children went on the specific carbohydrate diet, they did better. They grew, they gained, and they started absorbing their food. It was adopted in the 1980s by Elaine Gottschall, who had a daughter. She actually wrote this book, who had a daughter with ulcerative colitis. And her daughter wasn't responding well to medications, and she put her on this diet, and her daughter did better. So what is it? It's a grain-free, soy-free diet that's low in dairy and low in processed foods, preservatives, and additives. So it's a diet that focuses a lot on eating whole foods. This is a table of foods that are allowed on the diet and foods to avoid. But I think visuals are better. So this is like some of the foods that you can eat on SCD. Fish, aged cheeses, fruits and veggies. You don't see any processed foods here. You don't see any added sugars, which are not great for, health in general. And a big part of the diet is yogurt that you make yourself. It's fermented for 24 hours so that the bacteria and the probiotic content are very high and the lactose is non-existent. And if you've never made yogurt before, I would suggest trying it because it's very easy and it's delicious and it's great for you. So something that's great to incorporate in your diet every day. And this is the primary source of calcium on the diet. So I emphasize this in my patients on SCD. You should really be making yogurt or having some sort of cheese or high calcium food so that you are getting enough calcium for proper bone health. This is a website created by a teenager with Crohn's disease who went on the diet, and what he did was he went around to different stores and took pictures of SCD legal foods, and he posted them on the website, and you can click the different tabs and find out which condiments or which fruits or proteins can I have on the diet. And this is really helpful because the diet is really heavy on foods that you have to make yourself. So if there's any way to make it easier or more convenient, especially when you're traveling, I support that, and I want it to be something that you can easily incorporate into your diet. Almond milk, a lot of people ask me that, is almond milk allowed on the diet? Unfortunately, like most commercial almond milks are not allowed because they have those emulsifiers or those additives, those gums. So this is a nice one that I found that has none of those ingredients. It's kind of like buying a homemade almond milk. You might see it kind of separate because it doesn't have those emulsifiers. Just shake it up and you'll be emulsifying it that way. And then these are some great protein bars and some bread and muffin mixes. A lot of people who go on the diet miss grains. They can't have wheats. They can't have regular flour to make breads and muffins. So an alternative is almond and coconut flour, and that's basically what this is. It's just a mix of almond and coconut flour. And these are some nice pizza crusts made from almond and coconut flour instead of wheat flour. So this is a sample SCD menu. Each meal includes a protein, a carbohydrate, and a calcium-rich food source. So for breakfast, you could have like a medium apple with a 2-egg omelet, some tomatoes and spinach, and some cheddar cheese. I mean, that sounds pretty regular to me. I hear a lot of people eating that, and it doesn't sound like this crazy restrictive diet. Lunch, a medium orange, a chicken salad, 2 ounces of chicken, some chopped romaine, some cherry tomatoes, walnuts, olive oil, and some blue cheese. And then dinner could be baked trout with an almond crust instead of a wheat crust, with a little bit of cooked broccoli and some strawberries. And then for a snack, you can have your SCD legal yogurt with, a fruit. And this is, patients' response to the specific carbohydrate diet over time. This doctor did a survey of over 400 patients on the diet, and they started off with a lot of abdominal pain, diarrhea, bloody stool, limitation in activities, and then weight loss. And then over time on the diet, those symptoms decreased. And this is a really interesting case study that was published last year. This is just one patient, but it's just to give you an idea of like, okay, say you're starting the SCD. Your doctor's probably going to want to monitor remember your lab levels of your SAD rate and your stool calprotectin to assess your level of inflammation. And so this is the patient when they started tracking symptoms, right? They were on prednisone and methotrexate, and here's where they stopped the prednisone. And the blue is the stool calprotectin, and the red is the SED rate. So you can see that over time, it decreased. And here's where they started diet therapy. So they started exclusive enteral nutrition, which we'll get into in a bit. And then, that helped to keep the stool calprotectin and the SED rate. It helped it to go down. And then they started SCD, and it kept going down. And then they were able to, stop some of their medication and even liberalize their diet, and their inflammation levels stayed down. So that was a really interesting case study that was reported, and just gives you an idea of how, what your medical team is going to monitor if you do start, nutritional therapy. And this is a small study in pediatric patients showing that they had complete resolution of symptoms within 3 months, and their lab levels improved. And this shows you their clinical remission, right? This is a pediatric Crohn's disease activity index, and it was high when they started, and then it was basically non-existent after they were on the diet for some months. This just emphasizes that our kids on SCD grew, right? They gained height and they gained weight. So it can be a restrictive diet, but following it with a dietitian can help you to get the right nutrients you need to prevent malnutrition. This is another study looking at pediatric patients who had an improvement in their symptom scores, so clinical remission at weeks 12 and 52. And then when they looked with a capsule endoscopy, so a camera, they had improvement at week 12. And their SAD rate and albumin were unchanged. So there aren't any published controlled trials of specific carbohydrate diet and IBD yet, but the Crohn's and Colitis Foundation is studying the effect of SCD and Mediterranean diet in Crohn's disease. So I'm really looking forward to the results of that study. And then it can lead to nutrient deficiencies because you're cutting out, the grains and dairy. So we want to be careful of making sure you're getting enough B vitamins, vitamin E, vitamin D, and calcium. So work with your team to help make sure that you don't go into malnutrition. And then the supplemental things like vitamins and minerals need to be legal. They shouldn't have any like fillers or gluten or tapioca starch. And so this is a great resource for getting SCD legal vitamins. And when my patients go on this diet, I have a SCD guide that I give them along with resources for, recipes to help show them how exciting and delicious the diet can be. And then this is that website that I showed you earlier, the SCD shopping cart. And this is just like an online version of the book that the Breaking the Vicious Cycle. So exclusive enteral nutrition, what is it? It is where you get 100% of your nutrition needs from a formula, and it's routinely used in pediatric and Crohn's disease in Japan and Europe, and it's been shown to induce remission at a rate equivalent to steroids, heal the mucosa, right, both endoscopic and histologic. When they go in and look inside, it's healed, and then reduce pro-inflammatory cytokine levels, so just these inflammatory markers. The majority of studies support exclusive enteral nutrition as treatment for induction of remission in Crohn's disease, showing clinical and biochemical response within a few days of starting, within a few days. So that's quite impressive. This is a study showing remission rate at 8 weeks. 75% in those who drank the formula, and 85% in those who got the formula by an NG tube, so a nasogastric tube. So you can drink the formula, or you can, we have some people who self-insert a tube, maybe at night because they don't want to drink the formula, and they just get it overnight. And so maybe there's a slightly higher remission rate in those patients. It's not significant because they're getting more of the formula. This just shows that exclusive enteral nutrition is comparable to steroids, but it has less side effects than the steroids. So, and you also see mucosal healing, and you see weight gain, and you're getting adequate nutrition. And steroids can have a negative effect on your bone health. So this actually provides a lot of good calcium and vitamin D and protein and everything you need to stay healthy. So this study just looked at the effect of exclusive enteral nutrition on mucosal healing in children, and 79% were in complete clinical remission after 8 weeks on exclusive enteral nutrition. And it was associated with mucosal healing and decrease in inflammatory markers. This looks at inflammatory markers in adults. 71% achieved clinical remission after 4 weeks, and then decreased inflammatory markers in that group as well. And this was an interesting study looking at adults on exclusive enteral nutrition who were scheduled for surgery, and they put them on exclusive enteral nutrition, and 25% of them improved and no longer required surgery. They were on it for about 6 weeks. 94% tolerated at least 4 weeks. So we found that it decreased the need for urgent surgery, and it provided this safe bridge to elective and safer surgery, because the patients who had to go on for surgery had less post-op complications, right? They had less abscess, they had less leak. So here, this green represents complications, as well as the pink. And this is the exclusive enteral nutrition group. And this is the group who wasn't on exclusive enteral nutrition, way more complications. So, even 4 weeks of exclusive enteral nutrition can be really helpful in terms of improving outcomes. So the formula can be a polymeric formula, meaning intact proteins. So that would be like these Boost or Gain or Ensure, or it can be like a pre-digested formula or a completely digested formula. Now, I usually recommend these formulas for my patients because they taste better and they're cheaper. But if there's any sort of concern for malabsorption, then we move on to these Peptamen or more digested versions. And most of these are gluten-free, lactose-free, and kosher. So if my patient, yes. That's a great point. Yeah. So there is sugar in the formulas, but we have to remember that carbohydrates are the body's main source of energy, right? It's what your brain uses to function. So yeah, if you look at the label, sometimes that sugar amount can be shocking, but it's also balanced with good proteins and fats, right? And we see that it helps our patients. So it can, even though there's sugar in it, it reduces inflammation, it helps the mucosa to heal, and people get better outcomes with the formula. So the risks and benefits are very low with exclusive enteral nutrition, just that it can be hard to do because you can't have any food for a while. So we usually, counsel our patients that, some of the expectations of being on exclusive enteral nutrition are to do it for like 4 to 12 weeks, depending on your level of tolerance and how long you're able to do the therapy. But we do see that most people, achieve the best response if they're on it for 6 weeks. There's a lot of different formula options. So if you don't like, one formula, you can try a different one. And they also make different flavors, so like chocolate and vanilla, strawberry and mocha. So that kind of helps to increase the variety on the diet. It's not covered by insurance, but it's not that much more expensive than, food that you're buying. So it starts to get more expensive if you need some of those like more pre-digested formulas. So have a plan in place, like, with your doctor and your dietitian. Remember that it's only temporary, so it's not lifelong, and eventually you'll go back to regular food. And then even if you don't want to do exclusive enteral nutrition, you can do partial enteral nutrition, like half of your calories from formula and then half from a regular diet. And we see improvements in our patients there in terms of helping to induce remission when they're starting a biologic therapy. So there was one study that showed that 69% of people achieved remission on combo therapy, meaning infliximab or Remicade with partial formula versus 45 on the infliximab alone. And then those patients on the partial formula diet, 75% maintained remission for like a year out, so versus 49 who were just on infliximab. So even partial formula diet can be really beneficial. And then if you're already in remission, right? So what can we do to maintain your remission? So partial enteral nutrition is one of the diets we recommend, and that just basically means about half of your calories from formula and then the remainder from a regular diet. So say you need 1,800 calories a day, half of your calories would be 900 calories. There's about 250 calories per container. So that's like 3 or 4 of the, Boost or Gain Ensure a day to help you maintain remission. It can be helpful mainly in Crohn's disease, and it's more effective than a regular diet, as effective as some medications in maintaining remission in inactive Crohn's disease. This was a study looking at lower relapse rates in partial enteral nutrition versus, regular diet alone. And so here's the group that did not do anything, right? And then here's the group that was on the half formula diet. And this is the rate of relapse over time. So they actually stopped this study early because it was supposed to go out to 2 years, but they stopped it early because the half formula diet group was doing so well. So relapse rates significantly lower in partial formula group, 34% versus 64%. And this talks about clinical and endoscopic remission. So overnight feeding with a low-fat diet versus no intervention. The group on not on the partial formula diet had significantly higher rates of relapse after 1 year, and higher endoscopic inflammation scores, and higher levels of those pro-inflammatory markers. And this just shows you the partial formula group endoscopic recurrence after 6 and 12 months versus the ones on just a regular diet. So it's much higher rates of recurrence of inflammation in the group who wasn't on formula. And then as far as real foods go, a semi-vegetarian diet was studied in Crohn's disease in terms of looking at, rates of remission, maintenance in those groups. And semi-vegetarian diet is just everyday fruits, vegetables, legumes, potatoes, yogurt, once a week fish, once every 2 weeks meat. This is kind of like what the pyramid would look like for a semi-vegetarian diet. And these are all the patients that participated. These are the reasons that they stopped it, because some of them, they didn't want to do the semi-vegetarian diet, so they just went to omnivorous or just eating everything they wanted. 16 of the patients who remained on the semi-vegetarian diet for 2 years had 92% remission rate. After 2 years, 92%. And the ones who went back to a regular diet, the remission rate was only 25%. So this is clinical remission. It's something to consider. And, that's a pretty big difference, 92 versus 25. So when we're thinking about using nutrition in IBD, I just want you to keep in mind that it's not just diet alone, it's not just medications alone, it's not just stress management. It's really the combination of everything that's going to help you to have the best, control of your IBD. So talk to your doctor about your nutrition options or your medication options. Work on that, stress management. Get some exercise in, and really focus on eating, a diet rich in, whole foods to help your overall IBD. management. So in summary, diet plays a large role in quality of life, nutrition status, microbiome, and disease activity. And we talked about some therapies that can help to reduce inflammation or maintain remission. And these are some things that you should discuss with your doctor. Again, these are medically supervised diets, and you should be doing it along with your medical team. And your team is going to monitor your symptoms, your labs, your levels of mucosal healing, as well as other health measures. And again, in integrating these therapies with traditional therapies will help to give you the optimal response. And then there are those diets that can help manage your symptoms, but that's not necessarily going to affect inflammation, right? And here's my contact information. You can follow me on Twitter. You can send me an email. You can give me a call if you have any questions about anything that we talked about here today. Any questions? Yes. Yes, we do have vegan. So that would be like the more, yes, there's, Orgain has a vegan option. It's a plant-based formula. And then Kate Farms also has a vegan option. Yeah. Yes. Okay, the question is, where do you buy the Frida vitamins? So fridavitamins.com, that's where you get them. FREEDA vitamins.com. Yes. Yeah.
Is there any sort of efforts to tweak the SED to basically take a lot of the great stuff, but maybe incorporate some of the newer information?
Yeah, so the question is, can we follow a modified SCD and will it have the same effect? And, there are studies, or there's at least one study that was published recently that showed that, patients get the most response when they follow the diet strictly, and when they start to modify it, you lose that healing effect. So I would say just stick with SCD. Once you're in remission, then we can start to liberalize slowly, like adding one food at a time, and then just continuing to monitor your inflammatory markers and all of that to assess your response to adding those illegal foods back into the diet.
Can I ask you specifically what you think about honey as a sweetener?
Yeah, honey's fine. It's high in fructose, so it can, if you're eating a lot of it, it can induce symptoms. Just try to limit sugar intake in general, yeah, but honey's fine. Any other questions? Yes. You mean the case study? Okay, you want to know which foods lower the CRP? Yeah, so we do know that the diets that I just talked about, the specific carbohydrate diet, the exclusive enteral nutrition, those can help to lower the CRP, as well as the partial formula diet. So this one, right? Yeah. Yeah, so the CRP, this dual calprotectin, some are like more useful in patients versus other, like some will have more of a change in their CRP or their fecal calprotectin. Based on, it's very individualized, but that's just one of the markers that we use to measure like response to treatment. Does that answer your question? Uh-huh. Yeah. Okay, so the question is on partial formula diet, the sugar content is high, and is there a lower sugar formula? So the Orgain and the Kate Farms will have a lower sugar content than the other traditional formulas on the market. Yeah. Yes, in the front. Organic versus non-organic. If you can, I like to recommend organic fruits and vegetables and meats and just foods in general, just because there is less pesticides and antibiotic use and all the residues that could potentially impact health. So if you can buy organic, especially if you're going to eat like the skin of the fruit or vegetable, I would aim for that. And then when you get meats, they definitely should be organic, but that's just my preference. Like if you eat regular conventional foods, you're still going to get good nutrition. So if you can afford it, if you can do it, I would opt for that because it's just better for the environment and for ethical reasons. Yes, up in the front.
I have a question on the potassium and magnesium.
Uh-huh.
What vegetables or what foods would increase those levels?
Okay, so the question is which foods are high in potassium and magnesium? So potassium is high in a lot of citrus foods and tomato and a lot of fruits and vegetables in general. And then magnesium is high in like nuts and whole grains. Yes.
I'm wondering for white bread or wheat bread or white rice or brown rice, which one do you prefer?
So the question is, which do I prefer, whole grains or refined grains? And it's really, diet is very individual. So it depends on what's going on with you, like how you're feeling. Are you symptomatic or not? Did you just have surgery or not? So in general, when you're feeling well, aim for those whole grains. If you don't have any intestinal narrowing or stricturing, we want you to have a nice, like high fiber diet. And those fibrous components are really good for your microbiome, and because the bacteria in your gut take that fiber and they ferment it and they produce these things called short chain fatty acids, which are very anti-inflammatory. So when you are feeling good and if you don't have any intestinal narrowing, we want you to have a nice high fiber diet. But if you're not feeling so great and you're not eating well, sometimes doing like a low fiber diet can be helpful, just to help you feel better when you're eating. Yes. I do. I have some patients on that. Most of my patients will do like the specific carbohydrate diet or the exclusive ventral nutrition. But yes, we do have some people on that diet and they do feel better. Yes.
What kinds, if you're on a vegan diet, what kind of foods would be good for supplying the omega-3s?
Okay, vegan diet and omega-3s. So your source, omega-3s tend to come from fatty fish, but if you're vegan, you don't eat fish, so you can also get it from flaxseed, chia seed, hemp seed, or like, those will be the primary sources in your diet. Mm-hmm. Yes.
Use any food quality when you use a blender for your vegetables and nuts and so on, or something like that?
Okay, the question is, do we lose any food quality when we blenderize our vegetables? And no, if you're blenderizing it, you're getting like the full benefit. You're getting all the vitamins and minerals and phytonutrients and antioxidants, so that's great. We want you to blenderize your foods, especially if you're not able to eat them in whole form. But when you juice them, then that reduces some of the nutrients. So blenderizing is a great option and an easy to digest way to get in those foods. Yes, in the back.
You're showing use in different things that you may put out there non-GMOs and things like that.
What about the non-GMOs and what? Oh. Yeah, so she's asking about powdered versions or non-GMO versions of these formulas. We don't really know of any effect of GMOs on IBD at this point, so they're considered generally safe. And there is powdered formula of the versions of the formulas. The one's called Modulin, and that's the one that's used a lot in the studies looking at reduced rates of inflammation in IBD. But the problem is you can't get Modulin here. So you can get it if you're in Europe, you can't get it here. I think some people have successfully ordered it online from Canada or Amazon, but it's just hard to get. Yes.
Aside from Gatorade, what's the best way to introduce electrolytes back into your body?
That's a great question. So how do we get electrolytes aside from Gatorade? So Gatorade's a great electrolyte replacement beverage. It just can be a little sweet. So I usually recommend that my patients dilute it 1-to-1 with water. So if you're having Gatorade, a cup of Gatorade, do a cup of water, and that helps your body absorb the nutrients better. And then other options for electrolyte replacement beverages are going to be Pedialyte, or even something like coconut water can be really rehydrating. There is a standard World Health Organization recipe for rehydration solutions, which is basically like 4.5 cups of water, 6 teaspoons of sugar, and a half teaspoon of salt. So you can like make your own rehydration beverage at home, and then you can like squeeze like a little orange or lemon juice in there to make it a little more tasty. Yes. Yep, Absorb Plus. Yeah, so Absorb Plus, I haven't had any patients use that formula for exclusive enteral nutrition. I think there's a concern there just because it's not a complete formula. You have to like add things to it to make it complete, particularly like the essential fatty acids. So that is another option. We just need to make sure that you're getting all the nutrients you need when you use that formula. So transitioning, so the question is, once you induce remission through exclusive enteral nutrition and you transition to partial formula diet, do you have to do that forever? You know, there are no studies done. We just know that you're going to have a better chance of staying in remission if you're on partial formula diet. And then maybe you can, just work individually with your healthcare team to transition off of that into a just like general healthy Mediterranean, like high fiber diet, and then see how you tolerate. And if, inflammation starts to come back, then you have to address that. But I just don't know the answer to that. Yes, in the front. Yes.
Two-part question. I understand that you have multiple surgeries. You do not absorb B12 properly. That's the first. I just want a confirmation on that. And then can you replace it? Instead of replacing it with injections, can you replace it with foods?
Great question. So he's asking if you've had multiple surgeries, you absorb B12, and then instead of injections, how do you replace it? Is there a way to replace it with food? So you can have multiple surgeries and still absorb B12 fine. It's if you have inflammation or surgeries in the last part of your small intestine that we're concerned about you not absorbing B12, because when you eat B12, it's absorbed in the last part of your small intestine. So if that part is removed, then even if you eat foods that are high in B12, you're probably not going to absorb it, right? So there are other mechanisms of absorbing B12. So one of them is like sublingual. So you can do like tabs or pills of B12 that dissolve under your tongue, and you can absorb it that way. Otherwise, it would be through an injection. Yes?
The Harvard Healthy Weight diagram didn't have eggs on there, either avoid or good. Any suggestion on the protein? So is it healthy, neutral, bad?
So there is like epidemiological evidence showing that eggs increase risk for UC, for increased risk of flaring in ulcerative colitis, but it's not like cause and effect. It's just like something that they kind of observed in a population-based setting. Eggs are okay to have. I would make sure to get a variety of different proteins though. And when you have eggs, like if you have the ones where the chickens are fed like a diet rich in omega-3 fatty acids, and that's another great way to get in those nutrients. Okay, one more question and then we have to close. So you and back here. How can you reduce high B12? So you mean like your labs were checked and your B12 level was high? It's likely not that you're eating are you supplementing? Okay, if you're not supplementing, you could have something called, I don't know. You'll have to discuss that with your doctor. I don't want to like plant things in your head, but it's probably not coming from your diet. It's probably coming from something else. Okay, thank you so much for coming. Great questions.
Thank you so much, Kelly. That was wonderful. We're now going to have a 10-minute break as we prepare for our concluding talk, Updates in IBD Research, which will be here in the auditorium. We'll get started in here at 2:45. Thank you. That was wonderful. I love listening to you talk.
Oh, you're sweet.
It's just like so inspired by
Aw.
what you talk about. It just makes me feel like I'm doing the right thing.